Welcome to this video presentation. I'm Dinah Barry, a local councillor in Enfield, North London, and one of the organisers of a conference we held on cervical cancer awareness during Cervical Cancer Week in January 2021. All the presentations were full of important information, support and advice about cervical cancer. So we've now made them available as several standalone videos. Here we have the presentation from that conference by Dr Christine Ekechi. She's a consultant obstetrician and gynaecologist at Imperial College Healthcare NHS Trust in London. Christine spoke about the prevention of cervical cancer, the importance of screening, and also how different groups are affected by cancer and access to screening.
So I do a lot of work around cervical screening and prevention, and particularly about how do we encourage screening in hard to reach groups. So my talk is going to be about that. I'm now going to share my screen. So cervical cancer, when we hear this term, what comes to mind? I know it makes a lot of us worry, be nervous. Sometimes we don't even know what it means. However, you've all had a chat and had a presentation by Dr. Neetu, so you should all be up to speed. And I'm sure if I did a test, you would all get 10 out of 10. However, it's important that we bust the myths and the taboos, and we all feel comfortable with understanding what is cervical cancer and how can we reduce our risk. Cervical cancer is one of the 5 gynecological cancers, i.e. one of the 5 cancers that affects women. And it's important for us to understand about it because we can all do so much to reduce our risk, as we have heard so much about this morning. So when I think of cervical cancer, a number of images come to mind. We have the image to the top left hand of my screen, which is the speculum. And for many women, we see that and it strikes fear in our hearts. For any men who may be watching, they may not have the same feeling or understanding and understand why, for many of us women, it can put us off. The picture to the right of that is a picture of the HPV virus as we see it under a microscope. Down below is a woman pulling a jumper over her eyes, which I have to say, if I wasn't a gynecologist, that would be my thoughts every time I think of cervical screening test. There is an image about intercourse, having sex, and maybe we just shouldn't do it and therefore avoid our risk of cervical cancer completely. And then for those of us who are a little bit older, we may recognize the image of the woman in the middle, which is Jade Goody. Jade Goody was a celebrity in the 90s, if I remember correctly, who unfortunately died from cervical cancer. And why I put her image up there is because following her death from cervical cancer, her family did a lot of awareness around the importance of cervical screening. And what we saw was something that we called within our circles the Jade Goody effect, which was an increase in attendance to cervical screening. However, that effect has now declined and waned, and it's important that we remind people again about the importance of cervical screening. So what causes cervical cancer? Again, we've discussed this in detail. It's the human papillomavirus, and we know that there are high-risk types and low-risk types that can increase our risk. But it's important to know that having an infection with HPV does not automatically lead you to developing cervical cancer. We're all going to be exposed to HPV as soon as we expose our genitals. HPV infection is not confined to penetrative sex, and it's very, very important to stress this fact. So people who are in same-sex interactions who do not necessarily have penetrative sex can still be exposed to HPV infection. And I point to something important that Dr. Neetu said at the end of her talk about the language that we use and the inclusivity of the language that we use. It's important that everybody understands this. So irrespective of gender identity and irrespective of sexual behavior, ultimately, anybody that has a cervix has a risk of cervical cancer. We've talked a bit about HPV vaccination. We know now that a vaccine that protects against particular types, and particularly the high-risk types of HPV, significantly reduces the risk of the development of cervical cancer. But as I've said, once we expose our genitals, be it sexually or any other way, we will be exposed to the numerous types of HPV. And that is why, to get the biggest effect, beneficial effect from vaccination, it's important that we have that vaccination before we start having sexual interaction. And that is why vaccination is primarily directed at young girls of school age, and in fact, now young boys. There is a question that I've seen in the chat about HPV vaccination after a particular age. And whilst it may give some benefit, it won't be as great as if we were to have had that vaccination before we've been exposed to the number of different types of HPV. And again, to reiterate what my colleague has said before, HPV vaccination does not protect you against all types of HPV, and so continuing screening is vital. Again, another important note that HPV vaccination does not protect you against the other sexually transmitted infections, such as chlamydia and gonorrhea. And in that context, barrier contraception, which I mean condoms, is the best and effective way to prevent against the other sexually transmitted infections. So I'm sure you've all seen this before, the cervical cancer statistics in the UK, that we have just over 3,000 new cases of cervical cancer on average, and that we have over about 800 deaths from cervical cancer. That was the data of between 2015 and 2017. However, survival is good and survival is improved significantly by attendance to screening and detecting the precancerous cells. But for me, it's the final part of this slide that's really important, and that is close to 100% of cervical cancer cases are preventable. And we must keep this in mind and understand how we can do that. So we've talked about screening, and I'm not going to go into this in detail again, but screening is the best way to protect yourself from developing cervical cancer. And it does this by detecting the precancerous changes. Now, I've seen in the chat that there was a question about why screening moves from 3 yearly to 5 yearly after the age of 50. And that is because the incidence, so the chances of developing cervical cancer after the age of 50 on the background of a normal cervical screen history is reduced. What we don't want to do is to overscreen and overtreat, but we do still want to pick up precancerous changes. And that is why from the age of 50 to the age of 64, we move from screening every 3 years to every 5 years. We've talked again about how cervical screening has changed in the UK to now primarily focus on detecting the high-risk types. But if you look at this graph, this points to what I was talking about earlier, which is that cervical screening rates, worryingly, is now on the decline in the UK. And so why is this? It's important that we can't be complacent. We recently noted that the National Cervical Screening Programme has hit a 20-year low. And of course, if we are screening less women, that means that cervical cancer cases are on the rise. Now, what we're starting to understand is that there are certain groups that are at greater risk of cervical cancer. And this is linked very strongly to those people who attend cervical screening. We know that Black women are least likely to attend cervical screening, and it's important for us to understand why. Because we know that Black women are more likely to die once diagnosed with cervical cancer, primarily because they tend to present with more advanced stages of the disease. In 2014, I undertook a study trying to explore the attitudes around cervical cancer screening amongst Black women in London. And in this study, I and my colleagues surveyed just under 900 women to understand why they didn't attend for cervical screening. And a number of things came up, actually, which I don't think is particular to Black women. Many women talked about the difficulty in scheduling appointments. Some women talked about the difficulty in access. Some women talked about the fear associated with the cervical screening process. Many women talked about their religious beliefs, and there were many myths and taboos around cervical screening. So how do we separate fact from fiction? You've seen this slide already, and I think Dr. Neetu has done a great job in trying to dispel so many myths that are associated with cervical screening. But it's important for us to stress important facts here. The first is that going for a cervical screen is not associated with being loose. HPV infection is not seen as the same way as, for example, chlamydia or gonorrhea, which they themselves should be removed of stigma. As soon as we have any degree of sexual interaction, we will all be exposed to HPV. And it's important to uncouple any ideas around sexual behavior and activity with HPV infection. Abstinence, i.e. the avoidance of penetrative sex, will not fully protect you against being exposed to HPV. Vaccination will not fully protect you. It is not a disease that is confined to particular ethnic groups. So whoever we are, irrespective of our backgrounds, we will all and potentially be exposed to HPV and therefore cervical cancer. And screening should not be painful. So what do we need to do? It's important that we respond to our invitation request to attend for cervical screening. It's important that we educate ourselves by way of conferences like today, and that we take that education and we pass that on to our family and friends. And those of us that have young children, that we encourage them to take up the vaccination program when they are invited to do so. So, top tips. I would honestly say, and I have to admit, that going for cervical screen is not, top of our list of things to do, of excitement. However, it saves our lives. So this is the way we need to take it. Pre-pandemic, I would always advise people to take a friend. I acknowledge that this is very difficult now. As for us who work in clinical settings, we are trying to reduce the footfall to reduce exposure to coronavirus. However, make sure that when you are going for your cervical smear, that the nurse or doctor is very friendly and amenable. And if they're not, go somewhere else. Lots of women don't realize that the speculums come in different sizes. And what tends to happen is that sometimes a bigger speculum is used, and that is what makes it uncomfortable. So ask for the smallest speculum. And in fact, I would go as far as to say, ask for a plastic speculum, because the metal ones are just cold, and there's really no need for that. If they've only got the metal one, ask them to warm it up first, and they can do that by just running it under a hot tap. Take your phone with you and listen to music, anything that helps you relax at the points that you are having the cervical screen. Because when you are relaxed, the vaginal muscles are relaxed, and therefore it's much easier and less painful. And ultimately, remember that you are in control at all times. If you are not comfortable, if you are nervous, or it's painful, then you must say so. Ask them to stop and make sure that you are in a situation and in a space that is convenient and comfortable for you at all times. And it's just left for me to say, to remember that cervical screening saves lives. So please all attend your cervical screening when you're invited to do so.
I hope you found that both helpful and informative. This is one of a number of videos from the conference. If you want further information or have any questions, then please contact us. An email address will be at the end of the programme. Thank you for watching.